I'm so happy to meet with you all on this virtual platform. I just want to talk something about the mental health problems associated with COVID-19. All over the world, we are facing a pandemic, and of course, it has its own effects on the mind. What I have seen in the recent months is an increase in the number of patients coming with depressive and anxiety symptoms. Mainly more of an increase in depressive and anxiety symptoms. Initially, because there was this ban of liquor and all, there was a decrease in patients with substance use. But after the lifting of the ban, again patient has restarted coming with all those problems. And mainly what are the cause of this depressive and anxiety symptoms in all these people? One main cause is the financial problems, as we all know, because of the loss of job. Many daily wage workers and many people who were just earning their daily wage to earn their living, they lost their jobs, and financial problems. Some of them lost the some of them even though they are retaining the jobs, their salary is curtailed, and then the financial job related problem is one aspect. Many people who had just finished their studies waiting to enter a new job, suddenly facing this crisis, they are not able to, even recently some young people, they were they just finished their studies, they were waiting for the interview results, and they were waiting to join a new job, and suddenly this crisis came, and they had a huge setback in their life. So job related problems, financial problem is one huge burden that people are facing today. And another problem that they're facing is the interpersonal problems, like because of the COVID-19, so much of stigma is there. If somebody is tested positive, of course there should be isolation and quarantine, but they should be in contact with their relatives and friends, at least through telephone, video calls, audio calls, like that they should be in contact. But some people face such isolation and such quarantine and such ill treatment from their relatives and friends that they are kind of totally isolated, and they feel so frustrated. Nobody is able to really connect with them, and that results in much stress. All these problems will be kind of a burden upon their mind. Just like if there is a burden upon our head, it exerts a huge pressure on our body. So like that, if there is a burden upon our mind, that exerts a huge pressure on the whole being, and that is what we call stress. And because of that stress, there will be many neurochemical changes in the brain. And so one is this financial problems, other is this interpersonal problems with family, with friends, from the society. So many rumors would be there about the family and about their well-being and all. And then one another aspect is the fear of illness. That means actually they are fearing whether they are already carriers, whether they are even if there is a small cough and cold, whether this is COVID, and whether they will get this illness very soon, and whether they will be able to tide over the crisis. Then the fear about the future, how the future would be, how the finances would be, how they would be able to repay the loan. So like that, so much of fears and anxieties and all these problems accumulating together in their minds. And when people keep on brooding over these things, what will happen? When we brood over one same thing, just like you would have heard this small example of, if you hold this pen, it doesn't weigh much. But if you hold this pen for 1 hour, our hands will become numb, and we feel very heavy. If you hold this pen for 1 full day, we will feel all the more paralyzed and weak. If you keep on holding this pen for weeks together, what will happen? So like that, even if it is a small problem, when we keep on thinking about the same thing again and again and brood over the same thing, that stress will result in many neurochemical changes in our brain, and they will be resultant depressive and anxiety symptoms. Depressive symptoms mainly, they will feel very low in their mind, and then they will lose any interest in any pleasurable activities. They don't have any interest in anything, in the activities like hobbies and things that in which they used to find much interest and happiness. They are not able to find any interest nowadays. So that problem is there. And then other aspect of depression is the fatigability, easy fatigability and extreme tiredness. They feel like lying down all the time. Three cardinal symptoms of depression I was enumerating. One is this pervasive low mood, and then loss of interest in previously pleasurable activities, and then the third one is the increased fatigability, easy fatigability and increased tiredness and decreased energy levels and all. Then associated with all that, other depressive symptoms like sometimes they don't feel like interacting with others, isolating themselves, problems with attention and concentration. They feel very bleak and pessimistic views about their future, feelings of helplessness and hopelessness and worthlessness. And because of that feelings of hopelessness, they feel like harming themselves, ideas of self-harm, where they threaten self-harm, suicide attempts and suicidal threats and suicidal notes, and writing about suicide. And so like that, there can be many depressive symptoms, and associated with the depressive symptoms, there can be some psychotic symptoms also. Sometimes when depressive symptoms go to some extreme, they will develop some delusions, some false fixed beliefs, mainly persecutory and referential delusions usually associated with depression. Persecutory delusions meaning they feel that they begin to believe that others are all against them, others are plotting against them, others are planning against them. Referential delusion, where they think that others are all talking about them, others are referring to them, even things in the newspaper or TV are about them, like that. They take everything in a personal level. Referential delusion can be there. And sometimes nihilistic delusion associated with depression, like nothing has no meaning, anything, or everything has no, everything in the world has lost its meaning, and they feel that there is nothing else to hope for. Like that, there will be a nihilistic delusion. There can be some somatic delusions, like they have developed some illness. They false fixed beliefs that they have some illness. They may not be having any illness in fact, but they begin to feel that they have some great illness, and some people fear some, even whether they have. There were some reports where people who suddenly died of many cardiac problems and all, but actually when they were tested, they were all COVID negative, but probably because of the stress, the cardiac events would have increased, and that would have resulted in some deaths like that. And some reports were like that, they were there. So what happens is that when people begin to think negatively, the cognitive behavior theory, what we say in psychiatry, very basic triad of thought, emotions and behavior are there. So when these negative thoughts are there, that will lead to negative emotions. Negative thoughts meaning, what is the point in living? I don't have job, I have lost job, how will I face future? What will others think about me? How will I repay the loan? What will I answer when debtors come and ask me? So these negative thoughts, when they brood over that will lead to negative emotions. Negative emotions like that hopelessness and very sadness of mind and despair and feeling very low and all. So that kind of negative emotions would be there, and that will result in very negative behaviors like isolating themselves, sometimes suicidal attempts, and sometimes very the loss of control of the emotions. They become easily irritable and angry, and so many behavioral problems. Some resort to substance use excessively. Some resort to alcohol or other substances, cannabis or nicotine, like that. There can be increase in substance use. So they will get into this vicious cycle of negative thoughts and emotions and behavior, and that negative behavior again reinforcing the negative thoughts. And what happens is that because of that, because of the stress and resultant neurochemical changes in the brain, they lose the capacity to take logical, good decisions. So, and what happens? They, some people resort to committing suicide, and some people will be, taking very irrational decisions, and sometimes they go out of touch with reality and go into the psychotic realm. Because of the depressive symptoms itself, there can be many cognitive problems like memory problems and problems with decision taking and problems with planning and planning and executing things like that. So, what can we do in the face of this? I mean, I was trying to enumerate all the main mental health problems that people are facing. Of course, with regard to students and children, we can say about they are not able to go to school, they are not able to see their friends, they are not able to see their teachers because of that stress, and they are not able to go out and play because of the lockdown and quarantine. The public, they are not able to together play football and cricket and things like that, and they are forced to constrain themselves within the to be confined in the homes, and that will result in children's stress because parents are already stressed out. They are not able to seek children's welfare, and sometimes actually very vulnerable people, already they are, children and geriatric population, old age people are already vulnerable people, but in the wake of this COVID-19, they are all the more vulnerable. And they, because the middle-aged, the middle-aged young people, they themselves are stressed out, and they are not able to really seek the welfare of the children and the older people. So that results in much more stress in these two vulnerable groups, children and old age people, and that can result in many, loss of quality of life and so much of depression and so much of stress in their lives.